At Anthem Blue Cross and Blue Shield, we believe strong communities are healthy communities. That's why we proudly support nonprofits across Nevada dedicated to your health. Because we're here as a trusted partner in building healthier, happier communities.
Anthem Blue Cross and Blue Shield. Here for Las Vegas. Here for good. Here for you.
This is Straight No Chaser Talk Radio. We're just getting started. Straight No Chaser Talk Radio.
He's drinking that with no chaser.
Welcome to Straight No Chaser. So grab a glass and join your hosts, your girl Ann BZ, Thin Bad, and the Chief. Welcome to Straight No Chaser, where we never dilute the issues, we only serve the hard stuff. Tonight, we're going to talk about a very important issue, and that is health care. It's very important to men and women. We all have our share of issues that we face individually and collectively. And, of course, health issues and fitness have been a challenge for decades. But tonight we want to talk specifically about women's issues. So, gentlemen, we want you to really pay attention tonight. And, ladies, we'd like for you to pay attention, too, because we all have mothers, fathers, we have mothers, wives, sisters, friends. And while men, we have our own health challenges. We have to worry about prostate cancer, colon cancer, male pattern baldness, erectile dysfunction, and a host of other issues. The ladies, too, have their share of health challenges as well. They have to look at things like heart disease, breast cancer, ovarian and cervical cancer, gynecological issues, high-risk pregnancies, depression, and a host of other things that just really can really wreak havoc on our ladies and their families. So tonight, we're very fortunate. We have Dr. Eugene Albright. He has been in private practice for 30 years in the Riverside, California area, and he's here this evening to join us to kind of help us go over some of these issues that face ladies as they attempt to take care of their health. So, Dr. Albright, we really appreciate you coming on with us tonight as we try to talk about women's health, the myths and realities. Welcome to Straight No Chaser.
Thank you very much, Mike. I'm happy to join you.
Very good, very good. And it's great to be here. And also for our audience, Thin Bad is going to be off this week. And, of course, Ann Beasy is taking care of some things this evening. So it's just going to be Dr. Albright and I talking about this very important issue surrounding health care. So, Dr. Albright, I'd like to just jump right into it. As I said in the introduction, women face challenges on a variety of fronts when it comes to their health care. And I'm sure, as you know, as an OBGYN who's been practicing for 3 decades, over 3 decades, heart disease, breast cancer, high-risk pregnancies, and depression. And so why don't we jump right into the issue that is not the most important, but certainly you hear about it more so with the runs and the fundraisers, and that's breast cancer. Can you kind of tell us a little bit about breast cancer, how ladies can detect it, what they should do if they detect something abnormal? If you could just kind of start us off with that bit of information.
Sure, Mike. Well, the first thing that is most important for most women to realize is that the chance of them surviving breast cancer is early detection. And we don't stress it nearly enough, but self-breast examinations should be done at least monthly. Sometimes people say that every time you take a shower, you should examine your breasts and be on the lookout for lumps, bumps, things that are abnormal. You know your breast better than anyone else. And most women who survive detect cancer themselves, like detect the lump, get it evaluated, and those women are the ones who have the highest survival rates, because once it's very obvious and large, then our chance of saving the woman, saving the breast, et cetera, is much improved if we can catch it early.
Sure. Now, say, for example, that a lady does discover a lump. And I know this is might sound kind of stupid, but what should she do? Let's just say it's 5 o'clock in the afternoon and she's doing what you said. She's showering and discovers a lump. What should happen at that point?
Okay, because there are benign and malignant masses in the breast, and there's no way for her to be able to tell which it is. First thing she should do is make an appointment and get evaluated. And it doesn't really matter. She can go to her general practitioner, her OBGYN, surgeon. She just needs to be evaluated, and the sooner the better, because, like I said, it's a ticking bomb, and if she gets in and gets evaluated early, then her chance for survival is much better.
So would you recommend that the lady respond to the hospital?
Well, no, she probably should go to her doctor. Her doctor, be it a general practitioner or OBGYN, so that she can have the mass examined. And once we establish that there is something there, then we take it from there in terms of whether she needs, what kind of study she needs, whether she needs ultrasound or mammogram or biopsy. But the first step is getting to a healthcare professional, let them know that there's a problem so that we can evaluate and treat.
So what does the mammogram do?
A mammogram is a radiologic exam that can see through the breast and can pinpoint the mass, and certain masses have certain characteristics that you can't feel. However, a trained radiologist can give us a really good indication to whether that is a dangerous mass or it looks benign or whatever. But the first step is evaluate and see what we're dealing with.
And you mentioned malignant and benign. Can you explain those two terms?
Sure. A benign tumor is a mass that is not cancer. So that benign versus malignant is obviously the most important diagnostic difference between finding a mass that is just a soft tissue mass in the breast versus a cancer that's in the breast. And there's no way that you can feel that early and tell which. So you have to get in and give the healthcare professionals a chance to evaluate and make the diagnosis as to whether this is a benign or malignant lesion.
Now, the ultrasound that you mentioned, what is the purpose of the ultrasound versus the mammogram?
Okay. We're getting technical, and that is once a mass is detected, then we look for all the evidence we can in terms of trying to determine whether it's benign or malignant, whether it's solid or cystic. Cysts of the breast are very common, and most of the women who come in with concerns have cystic breast disease, which is benign but very common. However,
Sure.
You can't guess that it's a cyst, because if you guess wrong, then it just costs you your life. So it's very important to come in and have that mass evaluated. And we have a host of x-rays, mammograms, ultrasounds, stereotactic biopsy, directed biopsy, to determine whether that mass is dangerous or whether it's a benign mass that doesn't need treatment.
And what does the treatment consist of?
Well, it varies very much in terms of basically what stage the cancer is. If we catch it early, we can do lumpectomy. We take out the lump in question. If it's more advanced, we have to do a mastectomy, which is removing the entire breast. Sometimes we have to do a double mastectomy and remove both the breasts. And then there's chemotherapy and radiation, and all these things are determined by the stage and the advancement of the cancer.
Wow. And I may not be phrasing this properly, but overall, what is the success rate for treatment depending on if it's caught early?
Well, if it's caught early enough, you can be cured completely.
Oh,
and that's the preventative. That's where the preventative piece or the early detection comes in. Once it's advanced, we can do a lot of things in terms of slowing down the process or whatever. But once the cancer has left the breast, then it's just a matter of how long we can keep the person alive. But basically, after it's left the breast, there's no, 10-year survivors, or very few. So the most important thing is to catch it early, and early detection is the key to life.
Sure. Now, Dr. Albright, how often should a woman be examined per year?
That's an excellent question, Mike. And one of the things that I'm most uncomfortable about is certain healthcare systems now are telling women, well, you only need a pap smear every 5 years, or you only need to see your OBGYN every 5 years. Well, they're talking about the cervix, but, if a woman was just a cervix or a vagina walking around, that would be great. But what happens is when a woman comes in for her annual exam, one of the things that is a part of that is a breast exam. And so if you could imagine, you see me this month, and then you develop a small breast cancer next month, and then it's 5 years before you see me again. Wow. See, that could cost you your life. And so they're promoting this extended visits because they get the premiums, the same premiums, but if they can stretch out the visits for 5 years, they're doing, in my opinion, a disservice to the patient. But this is unfortunately about money. And so women are going for that, thinking that, oh, good, I don't have to get that dreaded pap smear every year, but they're forgetting about the whole woman, and that we, especially in my practice, I evaluate the whole woman. How you doing? Are you bleeding too much? Do you have anything else going on? Because it's an opportunity for a woman to have an annual evaluation of her entire health. And so it's much to their advantage to be seen at least yearly, because it might not be her cervix, it might be her breast, it might be that she's bleeding too much, it might be a host of other female issues. She may have chest pain. There may be a lot of different issues that come up when she's having that annual exam. And if she waits 5 years, it terrifies me to know that someone could be out there having issues that should be evaluated yearly, and now we're switching them to 5 years. So I'm very uncomfortable with that, and I don't think women should accept that, but it's a major issue right now going on in healthcare.
And as a practicing physician who's been doing this a while, what do you recommend for the ladies?
I recommend, now, depending on insurance, I understand that if they don't pay for it, that's one thing. But even if they only give you a pap smear once a year, you should still be evaluated yearly by your doctor.
And let's just say you can wave your magic wand and be king for or queen for a day, and you have that great deluxe insurance, then what would you recommend in terms of frequencies? And is that based on age or the frequency? I forgot to put that piece in there.